I hear a lot of mental health professionals throwing out the word niche and saying, do I need one? What is it? How do I figure out what mine is? And so today I'm going to break it down for you and answer all of those questions so that you know exactly what it is, why you need one, and how to figure out what yours is. So let's get into it. So, what is it? Your niche is your identified client. The simplest way I can put it. It is a person that you are trying to call to make sure that you have the people that you want to work with being able to find you, coming into your practice, and those are the ones that you're helping. That's your niche. It's your identified client. Now, this is really important. I know a lot of people take a very generalist approach and say, well, I like helping all people, or I like a lot of diversity in my caseload, and that's totally fine. But when it comes to having a niche, it's actually really important that you have one, in my opinion, because one, it helps target your marketing and advertising to a specific pain point, problem, or person so that they can find you and they know, okay, you're speaking specifically to me, and I'm probably going to be a good fit for your practice, or you're going to be a good therapist for me because you understand what I'm going through. And I feel like that you're kind of targeting me and my problems and saying, I want to help you. So it's great for marketing and advertising, first and foremost. It also can tell people who you are and the work that you do and the clients that you serve. And if I'm trying to find a therapist, I want to know, how are you going to help me? So if you have something that is very focused on pain points or problems that I have, then you're naturally going to stand out in the sea of therapists. And I'm more likely as a client to feel like, I think you can help me. And really, it's going to help you stand out. Having a niche helps you stand out. It helps you market better. It helps you target listings and advertising, and it helps you reach the specific clients that you want to work with. So I think having a niche is really important. There are some therapists who have very, very, very narrowed down specific niches. And then I have worked with other therapists who have more of a broader niche and it's not as narrowed or defined, and that works for them too. So I think it can be very focused if that's what you want, or it can be a little bit broader. But to say I'm a generalist, or to say I treat adults, children, teens, families, and couples, I'm confused. As a therapist, I'm confused. I'm like, but who do you serve? Because that sounds like everybody, and not everybody is going to be a good fit for your practice. And so I would want to know who is a good fit for your practice. Like, who are your ideal clients? And so let's talk a little bit about how to identify what your niche actually is. So I want you to think about past and current clients, and I want you to ask yourself the following questions. When you think about clients, which clients do you feel like stick out the most? And is that because these were hard to reach clients, hard to work with clients, or maybe they were clients that you felt like were really easy to work with or you really enjoyed the most? But think about all the clients that you've worked with or currently work with, which ones stick out the most and why? The next question would be, when you think about working with clients, what problems or pain points do you feel like excite you the most or that you're most passionate about? Are there topics? Are there interests? Are there problems that bring them to therapy that you feel like I really enjoy working specifically with those areas of focus? What are they? The next question is, when I'm working with clients, which clients do I feel like I have the easiest time relating to or connecting to? Now, over relating is not what I'm talking about. I'm just saying, in a general sense, like, who do you feel like you are really called to work with? Who do you feel like you really connect with the most or the easiest, or that you can really best understand their problems, their pain points, what they're going through? And then the last question is, what interests you the most? What areas of practice do you feel like really light you up, that you're really passionate about, that you want to know more about, or you just are really intrigued to work with those specific problems or areas of focus? Okay, now if you need to pause this video right here and complete your answers, that's absolutely fine. But I want you to make sure that you have some clarity on the answer to those questions before you move on to the next piece, because the next piece is we're actually going to help you figure out what your niche is. So take a minute, pause if you need to, and answer those questions. And then once you do, let's look at the answers. And I want you to look at, are there any similarities in my answers? Or is there any themes that are popping up in terms of clients that I worked with, populations, areas of focus? Like, is there anything that's kind of commonalities in the answers to my questions? Is there anything that really sticks out? And then we're going to take these similarities and we are going to slowly niche down until you get to a less broad sense of who you want to work with. Because right now, even with your answers, it still might seem really broad because I might say, well, I have enjoyed working with a lot of my clients, and some were older, and some were teens, and some were going through anxiety issues, and some are going through divorce. And that's kind of all over the place. And so we want to just kind of compile our answers and look for any similarities or commonalities, but we still need to niche down and get to a more narrowed view or focus of who we're actually trying to target or serve. So I asked you, what clients do you feel like really light you up? Like, what interests do you feel like that you're really passionate talking about or helping people work through? And this is important because certain individuals are naturally going to have certain pain points or problems more so than others. So if you're working with teens, you're not going to be talking about divorce or separation. You might be talking about breakups, but it's very, very different. If you are really enjoying working with the elder population, then those individuals are going to have their own set of unique challenges and obstacles that they're working with. So you may still have a very large kind of pool right now, but we are going to narrow it down. So look for similarities, look for commonalities, and then we are going to try to reduce this to more of a narrowed focus on who you're serving. So the first thing that I would encourage you to do is see if you can narrow down your targeted population based off of demographics. So do you like working with elder population more so? Or do you like working with children and doing play therapy? Or do you like addressing issues in young adulthood? Like, can you kind of narrow things down based off of any maybe age demographics, or specific problems or areas of focus? Like, I enjoy helping people with anxiety. Okay, that's still really broad, but we're starting to kind of narrow things down a little bit. So see if you can point out some kind of key things that help you narrow things down a little bit, whether that's specific population, a specific gender, a specific area of focus, a specific diagnosis, a specific life problem that you feel like is a reoccurring theme in your practice or a reoccurring theme in the clients that you really enjoy working with and helping out. And then from there, we're already starting to target things down because I used to say I loved working with individuals, families, couples, and elder teens and everybody in between. But now I'm saying, well, I really specifically like working with individuals who have self-esteem issues. Okay, we're already narrowing it down because self-esteem issues in a child and self-esteem issues in an elder adult are going to look very different. So what about self-esteem issues do you find most intriguing or interesting for you to work on? What specific conversations, coping strategies, interventions do you find that really kind of like light you up? What problems or obstacles do you really enjoy figuring out how to address? What about the self-esteem? And then from there, we just keep narrowing down that focus. And again, you can get as narrowed down as you'd like and speak to a very specific person, or you might be speaking to more of a group of people. If you have like special trainings or certifications that you feel like really help target specific audiences, you might actually just naturally be more niche down than somebody else. So if you are trained in EMDR, well, not everybody needs EMDR nor is looking for EMDR. So that's already going to really niche you down already. From there, you can niche down more if you like. Maybe I want to do EMDR with, you know, um, individuals who are struggling with traumatic experiences. Okay, that's pretty focused. Or you might say I provide EMDR to all adults, right? So that's broad, but still again focused because not all adults are going to need EMDR. So it might look like that, and you might be saying, no, I really just want to focus on EMDR, or I want to focus on EMDR for the specific population or pain point, and then I might also offer services for this person over here who might need EMDR at some point, but maybe isn't there yet. So that then I can offer them both. I can offer other services, but then if you feel like you need MDR, I can provide that for you too. That would be a very niche focus, but still kind of keep you open for more broader issues that maybe don't actually need to be addressed with EMDR. So that's more of a broader example. I would just, as a reminder, mention that your niche can change at any time. And so maybe now you're in a phase of life where you want a very focused niche, and maybe other times you want things to be a little bit broader or not as niche down, which is totally okay. I think there's benefits to being very niched. And then I think there's also some drawbacks to it if you yourself would like to work with other populations, other pain points, other diagnoses, or that's just not something that a lot of people are looking for in your area, which I do think is important to note. But I'm going to give you a very narrowed example next, and then you can kind of decide for yourself what feels best for you. So in this example, I start out with, I want to work with teens. I feel like that's the population that I want to serve the most. And then I narrow it down from there and say, well, what about teens do I really like treating or addressing? What are their pain points that I feel most called to work with? Because teens is still pretty broad. And that could be a variety of issues and challenges that are being presented, as well as a variety of diagnoses, which I might not enjoy working with all of those. So I start with teens, and then I go from there and I look at, okay, out of teenagers, I really feel most called to work with teen girls. And so now I'm already niching down a little bit further. And then I look at, well, what about teen girls do I feel like I'm really called to work with? And I look at, well, I did just recently, become specialized in eating disorders. And really, I like helping teen girls with eating disorders. Okay. I could stop right there, or I could take it even further and get more niche down. And I could say, out of the clients that I've worked with who did have eating disorders, who were teen girls, most of them were dancers or they did ballet in some form or fashion. And so I actually think I want to work with teen girls who struggle with eating disorders who also happen to be dancers. And that's a very, very specific niche. That is a specific person that you are looking for. And so naturally, that's a very narrow view of who you're going to be serving, but it calls right to the person that you need. So if you are looking for clients that fit that niche and your marketing material matches that, if I'm a teen girl who just so happens to be a dancer and I'm struggling with an eating disorder, boom, you are going to stick out as a therapist that I need to work with over everybody else because you're calling to me. You're literally speaking to me. And so that actually can be really helpful to get the right clients to you. But I could have stopped at the eating disorders and say, I really just want to work with teen girls who have eating disorders. Or I could have said, I really just want to work with teens who have eating disorders. And I'm going to specialize in eating disorders for teens and I'm going to see, all genders. And so you have a lot of options there, but you can get as narrowed down or not as you like, but you're still narrowing down the focus to specific populations, to specific issues, to specific modalities that you're using, specific things you're treating so that people know who you are and they know how to find you and they know what you specialize in and they know you're the right therapist for me because you're going to stick out in the sea of therapists because there's a lot of therapists out there. And if I'm just specializing in teens, adults, and children and self-esteem issues, well, then that same client is not going to feel like I stick out as much. And they're also not going to know, hey, I'm the right therapist for you because I actually know about this and I work on this and I'm targeting this. And those just happen to be exactly what you need in a therapist. So this is why niching down is really, really important. Now, in your process, as you're trying to figure this out, I really encourage you to think about not just who this ideal person is or this ideal client is, but is that something that is needed in your area? Because niching down is really important, but I also want to make sure that I'm not so niche down that I'm really speaking to such a small subset of people that I'm really limiting myself from being able to help other people out as well, or maybe people who have similar concerns, but they're not in that flow chart, right? They're somehow else coming to have the same problems or the same concerns or pain points, but maybe they're of a different demographic, or they have a different background, or they're a different gender, or what have you. So if you were really niching down and you got to the point where you said, using that same example, I'm working with teen girls who have eating disorders, who are dancers, and who also are non-denominational. Okay, that's a very, very specific person. And that might be a little too niche down. Um, and you might actually benefit from maybe taking away one of those parameters so that you still can help people who fall into that same kind of area of focus or area of interest to you in your practice, but you're not excluding people who potentially could be a good fit for your practice. But because your marketing and your advertising is so specific that they feel like that they're being kind of like deselected in one of those areas. So niching is important so that the right people can find you, so that people understand what is your interest, what are your area of focus, what's your expertise. But we also want to be careful that we're not niching so far down that we're excluding people who we might actually be a good fit for, but one or so criteria is not met because I'm so focused and so narrowed down that someone not checking all of those boxes would immediately say, oh, well, then this must not be the therapist for me. So it takes a little bit of finagling here. And again, you can change this at any time, but my hope is that you can see quickly that there is a very easy way to address this by just starting out with who do you want to serve? What are their pain points? What are their issues? Out of all of this, what are central themes? And then let me see if I can actually verbalize who this person is and what their pain points are. Because if you can, and you use that in your marketing, the clients that you feel most called or light up to work with, they're going to see that and they're going to think this is a therapist for me, and they'll be very quick to find you. If you're advertising yourself as a generalist, but you really do want to work with the elder population who's going through grief, then that should be your targeted audience. You should not have advertising that says you also work with children and do play therapy if you're really just trying to work with the elder adults who are going through grief. Like your advertising, your marketing, and who you're trying to serve should all come from this place of I'm trying to serve the elderly who are going through grief. I hope that makes sense. And if you do this, I'm very confident that you're going to be able to figure out what your niche is. And as always, you can change this, you can niche down further, you can not niche down as far. This is something that you don't have to have set in stone, but I do think it's really, really important to help you stand out, to help you get the right clients for you to be able to find you and to be in your practice, and that you can feel like that you're working with clients that light you up the most, and then you're not having to field lots of calls for, oh, I don't think they're a good fit for me, or oh, I don't really want to work with this client, or I find myself working with a lot of clients who I just don't feel really light up to serve, or I feel like that are not experiencing things that I feel like are really things that I want to be working with, or even things I feel like that I can help them with effectively. So I'm genuinely curious. What is your niche? Please let me know in the comments. I'm genuinely interested to see what your niche is. And if you're new here, make sure you subscribe and follow along so that you never miss anything. Until next time, bye.